Tuning into our Preparing for Pregnancy Masterclass right here on Parents You've Got This. If you're thinking about trying for a baby, well, you're in the right place. Today I'm going to be talking with two incredible experts all about trying for a baby. They're going to be sharing their tips and tricks on helping you get pregnant. First off, I have Wendy Fedele, who is our incredible dietitian and PCOS Georgiou, who is a fertility specialist and a gynecologist with extra training in reproductive services. So we're going to be talking to them both all about getting pregnant, and they're going to be sharing their advice on the best ways to do that. How are you, Wendy?
I'm really good, thank you. How are you?
Very well. So here is the lovely Wendy. For those of you who don't know her, she is our incredible dietitian expert here at Parents You've Got This. She has her own virtual clinic. So if you're wanting some personalised advice about your own particular circumstances, please do check her out. Give her a follow. She's got some incredible expertise to share with you about getting pregnant. And tonight she's going to be helping us all with some advice about getting pregnant. So Wendy, I just thought I'd just kick it straight off and talking about why is our diet so important when we're thinking about trying for a baby?
Yes, and it is one of my favorite areas to talk about because it is just such an important time and really an awesome opportunity. And I mean, there's so much when it comes to fertility that is outside of our control. And our diet is one of those things that is inside our control and has a direct impact on our fertility and everything from, ovulation and hormonal health to the health of our egg cells and sperm cells, the implantation environment, preparing for pregnancy and providing all the nutrients to support that. But also, there's lots of research now showing that what we eat and our nutrition status and lifestyle, even before we're pregnant, can actually have a lifelong impact on our baby's sort of future health. And that's not just for women, that's for men as well, and really can impact everything from, their risk of particular diseases, their metabolism, their mental health and cognitive function, risk of allergies, and those sorts of things. So it's just a really awesome window of opportunity. And yeah, so I love it.
Oh, it's so true, isn't it? So it's a really good time to think about what we're eating and what we're trying to create. And when we're doing that, Wendy, are there things that we should be eating and things that we should be avoiding if we're going to look at trying for a baby?
Yeah, look, but it's not as simple as, and eat this food, avoid that food. When it comes to what we should be including, it is more about dietary patterns, and the types of foods we're including rather than, eat a walnut or something.
Yes.
And so I guess I'll start with what we want to be eating more of. And a pretty good starting place is sort of the traditional Mediterranean style diet, because that provides a lot of things that we're looking for in this preconception period. So, a diversity of different plant based foods and a high intake of colourful fruits and veggies to provide us lots of antioxidants and polyphenols, which help to protect our reproductive cells from, oxidative stress and inflammation. So, they're really important. Then we want lots of good quality carbohydrates, and your whole grains are really great and are, excellent, especially from an implantation point of view, but to provide lots of fiber and nutrients. Um, Good quality fats and your omega-3 fatty acids, so getting your oily fish and seafood in there is really important as well. And just your good quality protein sources generally to provide lots of those important nutrients and things like iron that comes with it as well. Yeah, so that's sort of what we want to be including more of. And I guess a good message as well is that we want to avoid having too many restrictions in our diet, cutting out whole food groups, going on crazy crash diets where we're, avoiding carbs or whatever, because there are so many different nutrients that play a role in the reproductive process and infertility that we want to be eating broadly from across the food groups. And then sort of in terms of what we want to be having less of, or avoiding, look, hopefully sort of the more obvious one would be alcohol. That's for both men and women. So higher intakes of alcohol effect will women want to sort of be having as little as possible when trying to conceive, but for men as well, we know that that can also, a high intake of alcohol can impact the future health of the baby as well. So limiting that. Trying to avoid having a high intake of caffeine. So for the women that I see when they're trying to get pregnant, I'm generally telling them to stick with the pregnancy guidelines even at this stage. And so sticking to that less than 200 milligrams of caffeine a day. And then we want to be sort of limiting, very like lots of high sugar foods and saturated and trans fats. And so, your chocolates, cakes, pastries, ice creams, those sorts of things. Doesn't mean you can never have them, but we just want to be having less of them. And in particular, there's actually a reasonable amount of evidence around soft drinks, so high sugar drinks, that we want to be limiting those when we're trying to conceive. I'd also be mindful of starting to make sure that you're having low mercury fish rather than high mercury fish at this point. So that's avoiding things like shark or flake, swordfish, broadbill, catfish, marlin, fish and seafood otherwise, really great, especially your oily fish, but just those high mercury ones. And then starting to be mindful of your exposure to endocrine disrupting chemicals as well. So there are a few things to think about.
And so, Wendy, how long do you need to look at your diet before you conceive? Like, how long do they take to get those stores to the right levels?
Yeah, so look, it's the answer is, as long as ahead as you have is awesome because, nutrient changes, it takes time to sort of be able to build in that consistency and make those changes and to build up those stores. I guess something to keep in mind is that the the egg sort of maturation process is around about 3 months, and same for the sperm maturation. That's kind of a similar amount of time. So to get the whole sort of life cycle of the egg and to impact that, if you're starting at least 3 months before, then that is a good amount of time. When it comes to things like prenatal supplements and your folic acid and iodine, sort of the general advice is at least a month before, but if you can be starting 3 months prior, that's sort of ideally what I'd be aiming for.
And they're really important to take, aren't they, when you're thinking about having a baby? Can you talk a little bit more about prenatal vitamins? And I know when you go into like one of those big warehouses, there's like rows and rows and rows of them. It's like, how do you pick the right prenatal vitamin? Have you got any advice around that?
Yeah, look, so I guess the first message is to make sure that it is a prenatal multivitamin and not just a general multivitamin. Just because there are some nutrients that, if you were to fall pregnant, we don't want to have too much on board in pregnancy. So preformed vitamin A is one of those. And a prenatal multivitamin, is designed for pregnancy, so it won't have those sorts of things. But also, it will have the right amount of, folic acid and iodine, or folate and iodine, that we're looking for. And they're sort of the two key nutrients that is advised that, I don't want to say all, but because some people have contraindicating health conditions, but most women who are trying to conceive should be starting those prior to pregnancy. And that's because those two are really critical in the early stages of pregnancy. And often, we don't even know that we're pregnant by the time they're sort of playing their role. And they are nutrients that, for various reasons, many, many women just do not get enough of from their diet. So that's why they're a couple of the ones that we want to be aiming for. In terms of other things to look out for, look, generally it is a good idea to be picking one that has a reasonable amount of vitamin D, unless you're supplementing separately, particularly if you're living in Victoria, just because that plays a really critical role in fertility and pregnancy. And we know that particularly in Victoria, many, many women are depleting in vitamin D. So that would be one of the things I'd be looking out for. It's tricky because people will need different things from their prenatal vitamins, and they won't all be within the context of a multivitamin. So for some women, if they have, issues with egg health, or if they're trying to conceive past the age of 35, well, then there are some particular nutrients which have some good research that it can help in their situation. And so it might be adding additional things there. If you have nutrient deficiencies, then we would be looking for other things. So you might need to make sure that yours has a reasonable amount of iron, or that you're taking a separate iron supplement if you're actually deficient. If you are on more of a plant-based diet, or if you don't have a lot of fish and seafood in your diet, then we'll need some omega-3s, which wouldn't necessarily be in your prenatal. I don't tend to like them in the prenatal. And if you might need a higher amount of B12. So we do, if we can, it's ideal if we can tailor it to the individual, and blood tests can help us with that, but also reviewing diets as well.
And so that's why it's good to see someone like yourself, Wendy. What would happen if, you were thinking about trying for a baby and you wanted to come see someone like yourself? What's the sort of process to do that?
Yeah, so what you would do is, for my clients, I offer sort of discovery calls first, so we can have a bit of a chat, and then I would chat through your situation, and we would work out if there were any particular blood tests that might be useful for you to chat to your GP about, or your fertility specialist if you're seeing one, if you haven't had these bloods arranged already. And it might just be your standard, preconception bloods, and looking at iron and folate and vitamin D, which they would be anyway. Or if you have particular health concerns, or things that might impact your fertility, so things like PCOS or endometriosis, there would be other bloods that we'd be looking for. And then so in the appointment, we'd start with a really thorough assessment of your medical history, your blood tests, medication, supplement, your lifestyle in general, and of course your diet in a lot of detail. And then work out, your gaps, what we need to top up for you, your particular focuses, and then come up with a bit of a tailored plan, which would include a supplement plan as well. And for some people, it might just be that they need, a standard off-the-shelf prenatal multivitamin, and some are still better quality than others and more comprehensive from a nutrient point of view. So that's what I help sort of clients work out what suits them. And then, we would be topping up from there as needed with whatever suited their circumstances.
Oh, well, thank you so much, Wendy. As always, such a pleasure chatting to you. Do please give her a follow and check out her incredible advice. She's got such a great Insta page. It's always got good advice on there, so check it out. Thank you, Wendy.
Thank you so much for having me.
Pleasure.
Bye.
Our next expert is Dr. Hector Georgiou. So he will be coming on your screen any second now. And he's going to be chatting to us all about our lifestyle and some fertility factors that may impact our particular circumstances when we're trying to fall pregnant. How are you, Dr. Hector?
Hi, good evening. I'm very well. How are you?
Oh, very well. So lovely to see you to chat all things fertility and trying for a baby tonight.
I'm very happy to be here.
So, Hector, I thought we'd just start off with the basics. If you're thinking about, you know, trying for a baby with your partner, is the best place to start your GP to run some tests on where you're currently at?
I would definitely agree with that. I think just a simple preconception check before you start trying is always a good idea. So, specifically, things I'm thinking about is if the female partner is on specific medication that might not be pregnancy safe. So, always good to review those. Always a great idea to make sure that you're immune to things that ideally you're immune to pre-pregnancy, like rubella and varicella chickenpox. Um, the other thing that I always advise as well is to consider a genetic carrier screen. So that's to ensure that there's no risk of a genetic condition between that couple, because often there will not be a family history of, for example, cystic fibrosis within either side of the family. But when the couple comes together, suddenly that risk might arise. So it can help sort of alleviate any concerns from that point of view. So it's less about doing a huge number of tests, but just more having a chat and reviewing these few things.
And can you talk us through the menstrual cycle and the optimal time to try for everyone?
Yeah, absolutely. So I think we've all heard of the fertile window. And what's really important to note is that that begins before ovulation. So 5 days or so before, and then the day of ovulation is the window. And the reason for that is that sperm can survive in the vagina for a few days, and it's important that sperm is there because once the egg is released, it only lives for 24 hours. So it's quite a narrow time, and sperm has to travel a distance to reach it within the fallopian tube. So always a good idea to start having intercourse pre-ovulation. And what I find is the sort of two camps. You have one set of couples that will have regular intercourse 2 to 3 times a week from when the period finishes, and other couples are more interested to track the cycle and target sexual intercourse around the time of ovulation. Both are completely acceptable when we look at the research. There's no right or wrong. What's important is for the couples to do what's least stressful for them, because you hear that both of them could end up being stressful.
And women often have different lengths of menstrual cycle, don't they? So how do they work out when's the best time that they're ovulating?
Absolutely. And I've done a lot of research on this topic myself, actually, and there's lots of different ways, of course, that people can track their cycle, whether that's body temperature, cervical mucus, testing in the urine. Um, The jury is out, if I'm honest with you. What has the most evidence is doing urinary LH testing. But broadly speaking, ovulation will be 2 weeks before the subsequent period. But of course, you only work that out retrospectively, so it can be a little bit of a tough one.
When it comes to our fertility, Dr. Hector, what are some of the factors that impact our fertility that we should be mindful of?
Well, there's the big ones like age, overall health, and lifestyle. But there's also more subtle things like hormonal imbalances that can go hand in hand with, for example, polycystic ovarian syndrome, but also sperm quality issues, and importantly, whether the fallopian tubes are open in the context of natural conception. Another big one, of course, is endometriosis, which doesn't always affect fertility, but it very much can do. Um, and of course, it's not just women that we need to be thinking about. For men as well, things like keeping the genitals cool is important when it comes to sperm quality.
And so how long then do you recommend that couples try naturally before they say, they need to come and see someone like yourself?
So, it's important to remember that biologically speaking, women are born with all the eggs they're going to have in their lifetime. And with the passage of time, both their quantity and their quality will decline. And that will translate to sort of peak fertility in a woman's 20s and early 30s. And then from around 35 years onwards, there's a more sort of precipitous drop. It's not that something suddenly happens at 35, but that rate of decline that I've alluded to just becomes a little bit more acute. So, with that in mind, in terms of trying, it's very reasonable for couples where the woman is less than 35 to be trying for a year before seeking medical specialist attention. For those who are above 35, we would draw the line a little bit sooner at 6 months. Having said that, if there's something that's kind of concern within either member of the couple, for example, absence of periods or irregular periods or a history of endometriosis or some sort of testicular surgery, then I would forget what I just said and seek medical attention from the get-go.
Yeah, and there's also nothing wrong with just going to check that everything's working. Like you said, you might not know that you've got some of those factors until it happens. Do you want to talk a little bit about lifestyle and fertility and what we can do to ensure that we've got the best fertility we can have?
Definitely. I think my colleague Wendy already touched on some very important things, but there's the obvious ones like smoking is bad for you. It's bad for all aspects of life, but definitely fertility as well. In addition, limiting alcohol is important, maintaining a healthy weight, and keeping active. So a reasonable amount of exercise is very important. I won't claim to be the expert on nutrition, but certainly a Mediterranean diet that Wendy touched on is very important and probably ticks most, if not all, the boxes of nutrients that are required. The other one I'd like to touch on is the tricky one, which is stress. It's perhaps often overlooked. Um, And there's no easy way to sort of remove stress entirely from the equation, especially if there is a little bit of a delay to conception. Um, but finding a ways to sort of manage it, and some of my patients benefit from, for example, acupuncture or mindfulness. Anything, it's up to that individual, but anything to kind of improve stress, because we know that that can to a degree affect hormonal function and therefore ovulation, for example.
Yeah, it could be so hard, isn't it, when you're really wanting to get pregnant and you're trying really hard to not feel stressed out, particularly when other people are around you. It feels like everyone's getting pregnant if you're not getting pregnant. So that's really good advice there. We've had some questions around positions and food. Is it true that you can impact what gender your baby is with those things?
It's funny that you asked that. I've practiced a lot in the UK and now I've practiced in Australia for a few years, and it's funny how some of the myths know no borders. Because
That's
yeah,
okay.
that's something that I am often asked. But it is a myth. There's no sort of strong scientific evidence that any particular position or any particular diet will influence the gender of the baby. What we know, as we touched on already, is that the timing of intercourse is important in order to optimize the chance of conception. But, in terms of whether it's a boy or a girl, that's up to Mother Nature or whatever other belief system people might have.
That's right. And what about fitness? Can you be too fit or not fit enough? Does that impact our fertility?
So it is well documented that, for example, elite athletes, like if we look at Olympians, um, sometimes what happens is that their periods will stop, and that is a temporary thing, but it's the body's way of saying that often the body doesn't have enough fat stores, because we all have fat stores and they are essential for pregnancy. But if they're particularly low, the body sort of switches off the menstrual cycle in a protective kind of mechanism. That doesn't impact overall fertility, and cycles will return once weight is optimized. Um, but yes, to answer your question, that extreme can have that impact. And for people who struggle a little bit with being overweight, that can influence also cycle regularity. And there is some research as well that it can affect pregnancy complications, for example, the risk of miscarriage, or for example, some of the risks later on in pregnancy with gestational diabetes, to name another one.
Yeah. So if you're, over a certain age or you're not falling pregnant within those windows and you want to come and see a fertility specialist like yourself, Dr. Hector, can you talk a little bit about what that process entails and what some of the tests and things that would occur?
Mhm. I mean, practically, a patient could come and see me directly, but I would advise that they see a GP first, not only for the preconception discussion, but practically speaking, a referral will allow you to access Medicare rebates. Um, I think of myself, though, as a specialist, as a little bit of a detective trying to piece together what might be going on, but also very importantly, a coach, someone with a human touch, because this is a very sensitive topic, and it often needs a little bit of overcoming, developing a rapport, a relationship, so that we can work together to get to the bottom of it. So I really take the time to get to know both partners from a medical point of view, so that we can devise a personalized list of investigations that are likely to shed some lights on what might be going on, so that I can then guide the couple through the options that are available. The options can be a whole range, so it can be something as simple as optimizing timing with some scans to pinpoint ovulation, some blood tests to also confirm, so that then I can advise the couple when is that best time to have sexual intercourse. For example, in the circumstance that you touched on, where cycles are a little bit difficult to keep track of if they're not particularly regular, all the way to the other extreme of advanced medical treatments, which can include IVF, of course. Um, but just as important to this medical bits, it's important, I take it very seriously, to support couples emotionally through treatment. And couples do need to feel ultimately informed and understand why things are being done in terms of tests and why certain treatments are being proposed or not proposed for that matter, because these fertility problems can have a toll on relationships and people's individual well-being.
Yeah, definitely. And so you touched on IVF there. Can you talk a little bit more about what IVF is in a nutshell?
So IVF is a course of treatment, and it roughly takes about 2 weeks of sort of intense appointments and procedures. Um, but if we look at a natural cycle, first of all, in any given month, a woman has a batch of eggs that are available for ovulation. And from that batch, only one egg will mature and be released. And if that egg meets sperm, then hopefully pregnancy will happen along with implantation into the womb. But if not, during the period, the entire batch, including the ones that didn't ovulate, will sort of die off. And in the next month, there'll be a new batch. So what we do in IVF is we harvest that potential by giving injections so that the entire batch can start to mature, because it is only mature eggs that we can then collect sort of 10 or 12 days down the line of the injections. During the course of the injections, about halfway through, we add a second injection, and what that does is prevent the body from naturally releasing the eggs, because they are so minuscule that if they are released, we lose the potential of using them for the purpose of the IVF. And when we know the eggs are ready and mature, we collect them in a process typically done under sedation, and it's all done transvaginally. That means no cuts to the tummy. And the same day, the male partner gives us fresh sperm that we put together in the lab. So we have eggs, we have sperm, we put them together and we let them grow. The reason we do that is we know that not all eggs which fertilize will have the potential to give a pregnancy. And 5 days down the line, we're able to pick the best one and transfer it into the woman's womb in a process that's very similar to a pap smear. And then 10 days later, we do a pregnancy test and keep our fingers crossed that we have good news. Any extra embryos that we might have from the collection, we can freeze. And so that if we don't have success first time around, then we don't have to go through the whole process again to try again.
Well, that was so informative. Thank you so much, Dr. Hector. Really appreciate your time tonight. Make sure everyone you go over and give him a follow and check out all his great advice there. And if you're having trouble, we hope that tonight's talk gives you some advice and good luck. We've got an amazing pregnancy masterclass next Thursday for those of you who fall pregnant between now and then. We'd love to see you then. Thanks so much, Dr. Hector.
Thank you. Good
Thanks
night.
everyone for tuning in. Good night.